You're listening to the ISACA Podcast. I'm Safia, Kazi, Privacy Professional Practices Principal at ISACA, and I'm excited to be joined by my colleague, Collin.
Hi, thanks, Safia. I am Collin Better. I am the Emerging Technology Professional Practice Principal here at ISACA. And yeah, let's get in this. I'm pretty excited about this podcast. It's going to be an interesting one.
Yeah, so Collin and I recently co-authored an article about emerging healthcare technology. Now, this actually really started as Collin's idea. Collin, I think you were researching brain-computer interfaces. How exactly did that come up? What made you interested in researching that specifically?
Yeah, so it really just came out. So I'm a big tech guy. I love technology, but I think in today's day and society, you know, we're hearing about all this new technology, specifically AI, and you know, all these other big technologies that are coming down the pipeline. And Neuralink, you know, I listen to Elon Musk here and there, and I think Neuralink is something that's going to be super helpful. It's going to be something that's going to help a lot of people out, but I think there are quite a bit of some risks, some privacy issues, you know, a whole lot of issues that, you know, aren't being brought to light. And I thought that this would be a good chance to bring some of those things to light here.
Yeah. So in the context of our article, we use the term emerging health technologies, but that's kind of a huge umbrella encompassing a lot of different things. So yeah, it is encompassing things like Neuralink, like Collin mentioned, but we also think of it as wearable devices. So a fitness tracker might be an example of an emerging health technology. So just kind of to level set what we were talking about. Now, there were a lot of benefits that we saw when we were talking about emerging healthcare technology. Neuralink especially could have the potential to make the world feel a lot more accessible, which I think can be great, help people live independently, manage their disabilities on their own potentially, or just feel a little bit more empowered to take control of their health. Collin, what were some of the other benefits that we found while we were writing this article?
So another big thing or benefit that I thought was pretty important was like fitness trackers and, you know, how it helps people get out and be more fit and, you know, track their workouts and track their sleep, track their calories and things like that. So that's a pretty big important thing that I think is very helpful. Another one that I thought that was pretty cool was it helps sync to your phone. So, you know, your fitness tracker and stuff like that, you can, when you go to see your physician, you know, they can kind of see your health data and, you know, how active you are and, you know, how healthy you're being. So I thought that was pretty helpful as well and a good benefit.
Yeah, so those were some really interesting benefits. The other thing we found while researching is that people who had fitness trackers tended to make some healthier choices. On average, they walk about 1,000 steps more per day. They have more time being active. I know at the enterprise level, we often talk about how you can't manage what you can't measure, but I think the same thing holds true with health. That's one of the really cool things about health tech wearables is that it allows you to have metrics on things that ordinarily would be really hard for a person to manually track. But this makes it really easy and empowers people to make better choices. I think one other really promising use of emerging health tech that we're already seeing is that some technology can be used as almost a double check for physicians. So, you know, verifying that the way that an x-ray was interpreted is in fact correct and just having a fallback to make sure that the physician didn't make a mistake. Also identifying potential drug interactions. You know, a physician may prescribe a medication and not realize that that patient is taking something that could have some kind of negative consequence if paired with that new prescription. And emerging health technology can be a really great way to verify that everything is in fact safe and just providing another backup, ultimately leading to better outcomes for patients.
So I guess, Safia, what do you think about the emerging technology or the technology and getting into like the healthcare side of things?
So I think one of the really significant ethical concerns that we have right now is a lot of the organizations that are building this emerging health technology aren't actually healthcare organizations, which isn't necessarily a bad thing, but there are certain ways in which health-related developments happen just in order to maximize patient safety and minimize harm. And unfortunately, we're seeing that that's not necessarily happening with a lot of emerging health tech. So in our article, we talk about Neuralink specifically. There were a lot of monkeys who died after receiving the implant. Elon Musk claims that these were monkeys that were not particularly healthy, and it was likely not a result of Neuralink. But then former Neuralink employees are coming forward and saying that's not the case. Why would you put an implant in an already sick monkey? And they were also saying that a lot of the ways in which they recommended testing, changing one variable, doing testing, then testing another variable, it's something that healthcare often does in order to minimize harm and limit death, especially in things that are life or death kind of situations. And that was allegedly, according to these former employees, not followed in Neuralink. So while healthcare isn't necessarily the standard of ethical or fair behavior, healthcare does often do developments in a certain way to minimize the harm that comes to animals or humans who are in a clinical trial. And unfortunately, some emerging health technology organizations either aren't familiar with that or they're just rushing to production and they aren't doing things in the most ethical way and minimizing death and mortality among humans and animals. Collin, anything else to add about that ethical development and the way that's working?
No, I think you hit it on the head there. I hate to see animals and things being tested that's unethically and taking lives just for other gains. So yeah, I'm with you on that.
Yeah, and that's also a tricky thing because healthcare as it is, often animals are tested upon just for medication, even that aren't specific to technology, but they typically try to do it to minimize deaths. And I think that what we're seeing with some emerging health tech organizations, they're not designing in that way, which ultimately leads to more harm. But again, I think it is worth pointing out that healthcare just as an industry isn't necessarily free from ethical issues just in general. And so then when you add technology onto it, it just makes it a lot more complicated. So one of the other things, we were digging into this, and every time we talked about a benefit associated with emerging health technology, it felt like we had three harms that could come along with it. So in my role, I focus largely on privacy. So one thing that I think is really important to establish is that not all emerging healthcare devices are protected by healthcare-related laws. So healthcare data is not necessarily the same as health-related data. So for example, if I have a fitness tracker and it's tracking my sleep and my steps and my activity, that information is not going to be protected by a law like HIPAA. And I think a lot of people don't understand that. And that brings us to this idea of ethics versus compliance. The real ultimate point of our article is to emphasize why ethics is so important and understanding that compliance may be a decent starting point, but it shouldn't be the end-all be-all for how an organization defines and prioritizes ethics, largely because a lot of health-related information, especially collected from IoT-related devices, just aren't going to be subject to the same strict laws and regulations as other health-related data. Collin, what are some of your thoughts about privacy and some of these emerging health technologies that we're seeing out on the market?
I think that they're cool, but it comes down to these companies and these organizations, they want to, make things easier for people. And with that, you're going to get backdoors and privacy issues and risks, vulnerabilities all over the place. It's just the nature of how technology is, and it's unfortunate.
Yeah. Well, so the privacy piece is concerning. The security piece is, I think, just as concerning. So we found an example of an insulin pump that was, you could connect it with an app, which in theory is great. It makes it a lot more accessible. But there were researchers who found that they could hack the app to either withhold a dose of insulin or administer a lethal dose. So yes, emerging health technology can be great, but the possibilities associated with hacking a device like that could deliver lethal consequences to people is definitely something to think about. Collin, you've got much more of a security background than I do. What's your thoughts on the security associated with these kind of devices?
Sure. So the one that worries me the most, and I know it's still a little bit theoretical at this moment, is the Neuralink. And I can just imagine, down the line when maybe they deem it as, potentially like safe or not high risk. There's always going to be a way for people to break into things. And, imagine you have these Neuralinks attached to your brain and somebody breaks in, they could siphon out any of your thoughts or anything that, you're thinking about, and all of your, private information, private thoughts are just going to be going to somewhere. And another thing is, the companies that are storing this data, where is that actually located? How private is that? Is that able to be hacked? All of that personal information. Where is it going? Who's storing it? And are they ethical?
Yeah, while we were researching it, it didn't make it into the article, but we found a pair of headphones. I can't remember if they're still in beta or if they're actually for sale now. But basically, you wear them throughout the day and it tracks your productivity. And so then over time, it'll tell you, hey, at 10 a.m., you're really productive. While at 1 p.m., it dips. And then you have another spike in focus at 4 p.m. In theory, that sounds great. I would love to be able to know what works best with my natural productivity levels. But then Collin and I were talking, what happens if organizations start to provide this to their employees? I mean, that's scary tracking to tell people, hey, we noticed that in this meeting, you weren't actually paying attention. Or perhaps just exploiting people to say, well, if your most creative time is at 11 p.m., we want you working at 11. I think there's still a lot of gray area with how some of this technology is used or could be used. And I'm really curious to see how we can maximize the value of it while minimizing some of the consequences.
So, Safia, I guess what is the role of high quality data in these health tracking devices?
So I think high quality data is, or it should be, the absolute cornerstone in the development of all of this emerging healthcare technology. And that's true for devices that involve AI and those that don't. Simply because I'm sure we've all heard garbage in, garbage out. If you put bad data into a model, you're going to get bad results. But when we think about it in the context of healthcare, it becomes especially more concerning. So it's not just about having high quality data, but it's about having data scientists who understand the best way to look at data. So there's a really fantastic book called Invisible Women, and it's about data bias that we see that disproportionately affects women. And one really interesting thing that they found is that women typically exhibit different heart attack symptoms than men. So the idea of pain in the left arm, a lot of women don't experience that. It's more stomach pain. As a result, women will sometimes go to the hospital and they are turned away because they're not exhibiting typical heart attack symptoms, but that ultimately results in them having far worse outcomes. This is a problem because the data just isn't looked at across different traits. And if people are treated as a monolith, not examining certain things, it's going to result in certain groups having potentially much more harmful health-related outcomes. And then health data is also just tricky because it is so sensitive, especially for organizations that may be really on the cutting edge. Getting consent to have data might be really tough. You might be self-selecting from a group of people who are comfortable sharing their information, but those may be people who are more healthy, more comfortable, perhaps people who aren't as concerned about privacy or don't have any embarrassing health conditions. And that ultimately is going to affect the outcomes. Something else that was really interesting that we found while writing our article is a lot of people believe that bias is an issue in healthcare. And a lot of the people who believe that think that AI might be the fix to that, which is really funny because it's trained on the same data that healthcare providers are creating and generating. So there's a little bit of, I think, understanding that needs to exist that data isn't necessarily neutral. Data sets are going to have human bias. They're going to have the same flaws that as the people who are collecting them and cleansing them and labeling them, for example. So data quality really is critical. And I think understanding how to get data that best can help people, especially those who may be in smaller groups or in minorities, is really critical to making sure that these emerging tech devices are truly equitable. Collin, anything else you wanted to add about the data quality element?
No, I think you got everything there that I was thinking of for the most part. Yeah.
Yeah. The other really interesting thing is there's this idea that it can potentially replace the role of a healthcare provider. But, one of the conversations Collin and I had is that emerging health technology really stands out and can be some of the most impactful when it is coupled with human power. So maybe that means it's serving as a double check. Perhaps it's an initial questionnaire, something like a random forest when somebody walks into the ER determining, okay, they have taken this medication, they haven't done this. Here are some lifestyle issues. Here's a potential diagnosis. Let's get this person in to see a doctor right away. That can be really helpful rather than just relying on it kind of as a blanket to replace healthcare workers. That's kind of the way that we envisioned it.
Right. And just adding,
yeah.
And just adding on to that and kind of outside of the wearable, but just spitballing on the AI part, I recently went to the doctors, and my doctor, he knows kind of like what I do for work, and he asked me about AI, and he was like, yeah, some of our physicians are starting to use AI that kind of acts as a chatbot, and it kind of listens in on your conversation and documents all, everything that you are talking about, and then it creates this entire plan basically based on what you talked about. So going back to like where is that data being stored is just quite scary going forward.
Yeah, it's that. And I also wonder if the providers who do that are telling their patients that they're doing. I mean, I would hope that they are. But are people comfortable with that? I don't know that I would be necessarily.
No.
But I also know I tend to be a little bit more of a Luddite when it comes to certain technology, especially if it's related to my health.
Yeah, I used to not be, but now being in this field, I definitely have been more of a Luddite and steer away from jumping on the emerging technology bandwagon just as soon as things pop out.
Yeah, well, so one of the things that I know we've been, really critical of emerging health technologies, but there is some good to them as well. So there was another company, I believe it's called Synchron, that allowed somebody to just use their mind to control their Amazon Alexa device, which I think is so cool from an accessibility perspective, but also the fact that it could integrate with a device that's relatively commonplace. This isn't a fancy, super expensive, hard to find device. It's a device found in so many homes. I'm sorry, as soon as I said her name, many of yours went off. But yeah, Collin, what do you think about that integration with other household tech that people may already have? Is that a good thing? Is that something we should be concerned about? What are your thoughts?
Yeah, I think it's a good thing, but I also think that, it's something to be wary about. The good thing is that, people that are disabled and aren't able to do things, just day-to-day things that some of us are able to do, being able to just use text to speech or, just speech impaired patients can, take advantage of that and do things easier, have things more accessible to them, which I think is great. But then it all comes down to like how easy is it to break into some of these IoT devices that are just readily available. Like I know a lot of them just aren't secure or are just constantly listening to you. So for the average person, that's not the greatest thing. But I do think that there is a lot of really good things to come out of health wearable technology.
Mm-hmm. Yeah, I think one of the things that's really cool is there's so much promise, but with that comes this issue of the digital divide. As it is now, there are some people who just don't have access to certain technologies, and that makes it really challenging. And when you throw in the idea of healthcare, that could ultimately mean that people who are already struggling to get access to technology are now struggling with worse health outcomes simply because they don't have access. So as far as equity and accessibility goes with these emerging health devices, I think it's really important moving forward that organizations do what they can to ensure that systemic inequality is addressed to the best extent possible. And just making sure that, having access to something like Neuralink shouldn't be a prerequisite to living a healthy life and being a healthy person.
So Safia, I guess what are some of the strategies that you think are going to be important for moving forward?
Yeah, so any organization that develops emerging health technologies has to establish some kind of code of ethics. Compliance can't be it. Compliance is lagging behind. It has, and it will probably continue to in the future. So that is the absolute bare minimum. You need to go above and beyond to define what is it ethically that your organization seeks to do. And then also be really proactive about understanding how your technology could be used or misused in alignment with these ethics. The next thing that's really critical is involving people outside of the norm as you're developing these technologies. So obviously you're going to have people who are technical experts. You'll probably have AI experts. Healthcare experts should be involved. Ethicists should also be involved. People who are familiar with philosophy can be involved as well. I think that's really critical, especially if you're at an organization that is on the cutting edge of these emerging healthcare technologies. We talked about the role of good data. Having strong data governance practices in place is absolutely essential, especially if you're developing any kind of technology that leverages AI. As part of that, data lineage is so critical. Understanding where your data came from and ensuring that it is adequately protected as necessary is quite important. And then the idea of privacy by design and security by design are also really important, verifying that the technology is inherently privacy preserving and security preserving. And again, this is why it's so important for privacy and security professionals to work at and be involved in these organizations. But I think the most important thing that I would like to emphasize is that the role of ethics is more important now than it has ever been. These emerging healthcare technologies have the potential to do a lot of good, but also to do a lot of harm. I think we're kind of at an inflection point with them right now. And it's up to the professionals who are working at organizations developing these technologies to determine if these technologies are going to be used for good or for evil. Collin, any other insights on strategies for moving forward?
Strategy. Well, just adding on to that, these organizations that are creating these softwares or whatever, I just hope that, they aren't, money is obviously a big part. I just hope that, they come to their senses and they come together, as a group, and all the things that you spoke about. I think that, that's 100% needed. And, I hope these organizations just do better.
Yeah. Well, that's all we have time for in this episode of the ISACA Podcast. But if you're interested in learning more, be sure to read the article that Collin and I wrote titled Safely and Responsibly Using Emerging Health Technology. Thanks for listening to the ISACA Podcast.